The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to Conventus and Capehart Scatcherd's joint webinar on medical practice preparedness for the coronavirus. We appreciate you all being online with us and know that there is so much information coming out. This is such a fluid situation. Things are changing quickly, both on the state and federal level. So we're going to get pretty much quick to our presentation. So we just wanted to start off there. Disclaimer, you all can read that at your leisure. The slides, just so you know, are up and they will be on our website, as will be the recording as soon as we are finished with this presentation. Objectives, we want to go through some practical strategies on how to implement telehealth, telemedicine, both taking into account the federal and state laws. We know that they are changing pretty rapidly, and there's a relaxation of some stuff, but we want to make sure that you are all safe and that you follow the laws best as can during this turbulent time. We want to help give some explanation on the employee and human resources issues and some strategies to help, as this really is impacting our workforce at a greater level, and just identify solutions that all practices are going through and how you can mitigate those. Our speakers today, we have Sheila Mintz, who is the head of the Healthcare and Health Law and Partner Chair at Capehart Scatcherd, and Susan Lieberman, Vice President of Practice Resources at Conventus. So with that said, we are going to move on to our webinar, and I hope you all have a great day.
Thank you, Carolyn. This is Susan Lieberman. We wanted to get right to this, and we've developed this webinar based on many of the questions that are flooding into us, and the biggest one that we've been answering is about telemedicine. In this state of public health emergency, many physicians' practices, if not most, are going to telehealth and telemedicine. So we wanted to be able to provide you with the laws and the regulations, which in some cases are changing by the minute, and also New Jersey regulations, and then give you some practical strategies of how to implement. So here we go without further ado. So just wanted to let you know that the first thing, some common considerations, no matter what state that you are in, is that you need to be licensed where the patient is located during the telemedicine encounter. Now, we're going to go over relaxation of that rule, both by Medicare and also now by New Jersey, because as of yesterday, that is changing. But you still need to know your state laws, because state laws can supersede federal laws. So you really need to know what your state laws are. And some of you may not be on this call, may not specifically be from New Jersey. You also should know whether your state participates in the Interstate Medical Licensure Compact. And I've given you the website to go to check that. New Jersey does not participate in that, but many other states do. And what that does is that you can get expedited licensure if your state is part of that, with other states that are also participating. Just so that you know, when you are doing telemedicine, you are held to the standard of care at the originating site, which means you as the healthcare practitioner, wherever you are in whatever state you're in, and at the distant sites, where the patient is located at the time of the visit, not where the patient lives, but where the patient is located at the time of the visit. So one of the first things that you need to ask is the patient is where they are located. The second thing that I want to emphasize is that the law holds you, no matter what state you're in, to the same standard of care as if the patient were being seen in an in-office visit. So that really is across state. It doesn't matter what state you're in. And also, I suggest that you check your federal and private payers for their requirements for telemedicine, what their payment option, what they'll pay for via telemedicine and what they won't. And that will be not only, for example, if you are participate in Aetna, but it might be down to the specific plan of whether or not the patient has coverage for telemedicine and for what. And also, each of the payers may have different billing code requirements. We are not going to go over the billing code requirements during this webinar, but I will give you, we do have a white paper or a physician guide that I will in a little while give you a link to so that you can start to look for the billing codes. Just a sec.
Go ahead.
Great. So here's some more common considerations. As you know, that under normal circumstances, you need to comply with HIPAA regulations, both in your state and federally. That is being relaxed both at the federal government and also on a state-by-state basis. I'll go over that in a little while in greater depth. And if you do have a telehealth app that is HIPAA compliant, you really still need to have a business associate agreement. The other thing that I want to go over, and these are being relaxed also, some of these requirements, is patient consent. So you need to have patient consent both for letting them know what the risks and benefits are of telemedicine and telehealth. You need to tell them about privacy and confidentiality, and if you know that your equipment is HIPAA compliant, and also to remind the patient that on their end, this is, they need to protect their privacy and to try not to minimize who is around and who can look at the screen. I would suggest that you let them know upfront the technology, what's needed. What happens if you have technology issues and you're cut off? How are you going to complete that visit? How are you going to communicate with the patient afterwards? And of course, they need to know the billing and payment as well. So those are some of the things on patient consent. As I said, the laws in the past couple of days are being relaxed, but these are good practices that you still need to do. They also, under normal circumstances, you would have notice of privacy practice and all of that. Okay, some other common considerations are if you have an electronic health record, please leverage your telemedicine module and your patient portals. That's why you have it now, and this is a great time to use it. We have investigated some free or subscription-based telemedicine products, such as DoxyMe. DoxyMe is for free, so for those of you who want to get on it, please do so. We still do suggest that you have a HIPAA compliant product. There's another one called VC. We just listened to their webinar yesterday, and I can tell you that the free version is crashing because they have so much traffic on trying to use the free version. I believe the paid version is only $49 per month per user, so it's still really cheap. And then there's Metasprout. The federal government has now said that you can use things such as FaceTime, but it has to be non-public facing. So you couldn't use Facebook Live or things like that. It has to be non-public facing. It goes without saying that medical record documentation should be the same as an in-office visit. There is no difference between that, and you need to keep that documentation for however long your state requires that. I strongly suggest that you check with your medical liability carrier to ensure that you are covered for telemedicine and telehealth. And if not, or obtain that coverage. Here at Conventus, we do cover telemedicine, telehealth for reasonable use. So that means that following the laws and regulations as they are stated. Some other coverages that you may want to look at is cyber liability, because now the cyber hackers are probably going to try to use this opportunity to hack. And so you want to have cyber liability coverage. At Conventus, certainly we do provide that. And also business interruption coverage. You may have business interruption coverage if you get hacked through cyber liability. You may also want to have separate business interruption coverage that covers more expanded circumstances where you will be covered. Some other common, so those are the common technology issues that, regardless of what state you're in, we suggest that you consider all of those things. So now I want to go into the Medicare benefits expansion, but before you do that, I just want to remind you that we are taking questions, so that there is a questions panel, and you can type in your questions, and at the end of the presentation, we're going to take as many of these questions as we possibly can in the allotted time. If we do not have time to answer your question, what we're going to do is type it up and send it out to all of the attendees. So before we begin, I just wanted to let you know that be assured that we're going to answer your questions regardless of whether we can do it today or not. So let's get to the Medicare benefits expansion. As of March 6th, there is a waiver, and that will remain in effect until the Department of Health and Human Services lifts the public health emergency. So as long as we're in this public health emergency, this waiver will apply. And there's also something called the Coronavirus Preparedness and Response Supplemental Appropriations Act that was instituted as of March 9th. But I do want to let you know, I'm going to keep stressing this because we have people from different states. Please check your state laws. State laws supersede Medicare laws. New Jersey, as you'll see, has instituted or passed new law for telemedicine as of yesterday, and we will be going over that. But you really need to check your state laws. So let's go through some of this. Is just a very high level of some of the Medicare benefits expansion and changes. They've removed the same state licensure requirements. In other words, you can practice telemedicine across state lines if you don't have a license in the distant state or where the patient is located, only if you hold an equivalent license in another state in good standing and for what you are licensed for. The geographic limitations have been lifted, so they'll pay for professional services furnished in all areas of the country and in all settings. Before, it had to be in a metropolitan statistical area and rural settings. That means that they will allow patients to be seen at their place of residence, which was not allowed before. So they'll pay for office, hospital, or a patient's home. They are also instituted payment parity so that means the telehealth encounter will be paid at the same rate as an in-office visit. And again, I can't stress this one also enough, that for telemedicine, all services must be initiated by the patient. Now, you can beforehand tell the patient how to get on, and that's what you're going to have. That's what you do and how to get on, but the patient must initiate the telemedicine encounter. Some of the other things that have been relaxed is that audits will not be conducted by the Department of Health and Human Services to ensure that you've had a prior relationship with the patient, which was required before. And there's also a waiver of penalties by the Office of Civil Rights. Basically, they have the discretion to waive penalties for HIPAA violations. And the key is that serve in patient's good faith. So you try to do the best you can. You're not having anything that's public facing. We strongly suggest that you get a HIPAA compliant telemedicine app because they're out there and they're for free. But as long as you're doing what you're doing in good faith, it appears that the Office of Civil Rights will not, will waive some of those penalties. But again, please, 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 there are ways to do this in a HIPAA compliant app. So I want to direct you now, because we do not have time to go over all the details of the Medicare benefits expansion, including how to bill and all of that. We just don't have time in this particular webinar. So I want to direct you to our website, www.conventusnj.com. And we have a very extensive physician practice COVID-19 guide that includes some of these codes, as well as many more things. What you'll have to do is on the menu, just click Practice Resources, and up will pop COVID-19 resources. Click on that, and all the resources that we have, we've made public facing so that you all can access it. We really felt that this was important for all the community, not just Conventus members. So this is hot off the press legislation in New Jersey. It was just signed yesterday by Governor Murphy. It was introduced on March 16th. So the first bill is A3860, and which says that you can bill for telehealth, telemedicine, regardless of whether state regulations have been adopted. The New Jersey Board of Medical Examiners has proposed regulations, but at this time, as far as we are aware, those regulations have not yet been adopted. I can tell you they're basically the same as the telemedicine law, with a few minor exceptions, but they're basically the same as the telemedicine law. And they've also said, the legislation also says that healthcare practitioners who are not licensed or certified in New Jersey may provide telehealth or telemedicine as well. So now they're following along with Medicare. However, you also need to be licensed in another state or territory in good standing, just like Medicare says. The care has to be limited to screening, diagnosing, and treating COVID-19 if you don't have a pre-existing relationship with the patient. And if after you start the telemedicine encounter, you realize, and you do not have a pre-existing relationship, and you realize that this has nothing to do with COVID-19, you cannot charge for the visit, and you have to refer to a licensed New Jersey provider. So that's hot off the press as of yesterday. And it was signed yesterday as well. Again, the director of the Division of Consumer Affairs is waiving any state law or regulation on telemedicine or telehealth during the public health emergency, except, and this is an exception, nothing authorizes waiver of requirements restricting collection, exchange, transmission, or use of confidential patient health information, which to our interpretation means you really should try to have a HIPAA compliant telehealth or telemedicine application. Again, if all else fails and you want to use something like FaceTime, please, it cannot be a public facing application like a Facebook Live. The next law is A3682, and it was introduced on March 16th, signed on the 19th, and permits professional and occupational licensing boards to expedite licensure during this public health emergency, which means that they may be foregoing criminal background checks and things like that. So now let's get into the New Jersey telemedicine law. And please remember to give us your questions in the chat. The telemedicine law in New Jersey was established or was passed on July 21st, 2017, and there's been some confusion about this, so I want to state this up front. It's for new and established patients, so it can be an initial encounter also, but you need to follow the state law. You need to be licensed, certified, registered in New Jersey, and you should have existing liability insurance because those still apply. By the way, many of the other states have very similar laws, so please check your laws as well, but most of them are very similar. And you are subject to New Jersey jurisdiction if the patient or you are located in New Jersey. Again, if they're outside of New Jersey, you will be held to New Jersey law plus the law of where the patient is located at the time. You must have a provider relationship, a physician-provider relationship. That means that, number one, you need to properly identify the patient and location up front before you start the actual visit, which means some of the identifiers may be name, date of birth, phone number, address, health insurance number, etc. It requires you to review patient history and other pertinent information. If you've never seen the patient before, and this is a new patient, I suggest that you send your new patient packet to them, along with your, HIPAA notice of privacy practices and your patient assessment, so that you can review all of that beforehand if you do not have a patient record available. You need to disclose the provider's identity, which includes your licensure, your specialty, if you're board certified, and your contact information. And you need to make yourself available with that contact information to the patient for at least 72 hours following the provision of services. Again, we cannot stress this enough, whatever state that you're in, you need to determine, number one, when you review the patient assessment, and number two, when you start the telemedicine encounter and during the telemedicine encounter, if you can meet the same standard of care as can be met in an in-visit visit before and during each encounter. So if you're feeling like, I really need to see this patient, or they need to go to an urgent care center or whatever, you need to let them know and let them know you can't continue that encounter. Prior to the initial encounter, we've already talked about reviewing the patient history and available medical records. If you've already seen the patient before, you can do that during the visit because you have records already. And again, send the new patient packet along with HIPAA privacy notices, along with, if you can, send a consent about the risks and benefits of telemedicine, do so. These are the types of consent that you need. Prior to the encounter, obviously, like you would always get, you need your treatment consent, notice of privacy practices, if you can. If the patient is elderly and is homebound and can't do that and has no way to do that, you don't have a patient portal, or there's no encrypted email, I would get that at the time that the encounter starts. And again, the risks, benefits of telemedicine. Again, a lot of this has been relaxed with the OCR. So, so do the best you can. We do have for our Conventus members, we do have a consent form that we can send you if you let us know. And I would go over some of those contents with the patient during the encounter if you cannot get it up front. The patient does have the ability to request the medical records going directly to the patient or directly to the PCP, and that can be either in oral, written, or digital form, that type of consent. Technology needs to be interactive, real-time two-way communication, asynchronous store and forward to allow for transmission of images, diagnoses, data, medical information. That's the asynchronous store and forward, where you're getting your diagnostic imaging and test results. Or interactive, real-time, two-way audio with asynchronous store and forward only, and without video capabilities, only if the provider, you as the provider, determines that you can meet the same standard of care as if it was an inpatient visit. And I can't stress more enough that you need to maintain complete medical records as if they came into your office. So whatever state law you are that applies to you, you need to follow your medical record documentation state law. I've given the citing here for New Jersey. Prescriptions in New Jersey. Again, you have to have that proper provider-patient relationship. You can't prescribe solely on an online questionnaire, so they can't just fill out a questionnaire and you prescribe. You have to actually have a telemedicine encounter. However, for Schedule II CDS, the patient still needs to have an inpatient visit and be seen inpatient every 3 months thereafter. That may be relaxed, but at this point, that's what the telemedicine regulations state. Exceptions, stimulants for patients less than 18 years old may have parent guardian signature, as long as there's two-way audio and video. You need to have make sure that there's appropriate follow-up with the patient as far as if they need to be referred to any specialist, or they may have to be referred for emergency care. And again, there's been some question. This is for the New Jersey telemedicine law applies to both new and established patients. Just want to go over the New Jersey payers and getting paid for this telemedicine service. We have much more detail that all of you can get on our Conventus website through our COVID-19 Physician Practice Resource Guide. We don't have time to go all over it all today, but just to let you know that the Department of Banking and Insurance has issued a bulletin that advises all carriers in our state to develop robust telehealth programs. And but I suggest that you look for communications from your payers, because this is evolving almost by the minute. Also, there may be coverage and reimbursement policies that are different for the commercial carriers, for the private carriers, between payers. So you need to check with each carrier. Private payers are more and more starting to follow Medicare policies during this public health emergency. We have much more detail on this. Can't go over it in the time that we have allotted. Perhaps we'll do it in a follow-up webinar, but please go to our website. You will get much more detailed information. Medicaid, as you know, is administered by each of the states, so you need to go to your state Medicaid. Medicaid is managed by your states. So please go to your state website, and we've given you some resources to go to Medicaid and find your state and look for what's covered and what's not for telemedicine, telehealth. Medicaid does cover for some telemedicine and telehealth. So with that, I'd like to turn it over to Sheila, who is going to go into some of the employee and human resources issues. This is totally hot off the press. And Sheila, thank you so much last night for reviewing all of that law and figuring out what it means. So I turn it over to you now, Sheila.
Thank you, Susan. Yeah, it's been quite a scramble, and for anyone who has insomnia during this period, I recommend reading the Family First Act in its 112-page glory. But anyway, I managed to sift through it. But before I get started, I'd just like to say thank you to, on behalf, I'm sure I speak on behalf of all of us, to all of the providers that are working so hard right now to keep all of us safe during this crisis. And, you know, we all stand ready to do whatever we can to make your lives a little bit easier and provide you with the information you need to manage your practices as you go forward. So the thing that I want to talk about, if I can get my slides to go, can someone do the next slide for me?
We got it. Well done.
No, it won't move now. It was moving before. Oh, there it goes. Okay. So to talk about the bill that was passed the day before yesterday and signed by the president, which goes into effect on April 2nd. This expands, it changes a lot of things related to telemedicine, which Susan went over, related to health coverage for women and infants and children, food stamps, meal delivery for elderly, expanding unemployment benefits, payment for coronavirus testing for uninsured, and for Medicare, Medicaid, Medicare Advantage, all waiving a lot of the copays for that. But what I'm going to focus on right now is the additions to the Federal Family Medical Leave Act and paid sick leave, because I've been talking to a lot of my clients over the past several days, and for those clients that have large practices that are not directly related to infectious disease or family medicine, that are in the process of having to lay off staff or contemplating layoff staff, that you need to know what you need to advise your staff as they go through this, as people are dealing with staff members whose children are out of school and who may not be able to come to work, whose family members may be ill. So just to be able to understand what your obligations are to them going forward during this crisis, to be able to figure out how you can maintain your practice and sort of plan for the time when this is no longer an issue, hopefully, and be able to resume normal practice with your existing staff. So the Family Medical Leave Act, and there's paid sick leave for qualifying employees, which in New Jersey is in addition to the existing sick leave that's already mandated by state law. But that is not true, I know, in Pennsylvania, and there are other states which may not have mandated sick leave. So it would only cover those practices that have sick leave in addition to what's mandated by the state or anyway, so, and then also, people are wondering, okay, well, if I'm paying all of these people, all of my staff members, and I've got no patients coming in the door, and my cash flow is sinking every day, what do I do in terms of how do I manage my cash outlay, and what protects the small business in this issue? So there's going to be a tax credit for employers for payments for FMLA and sick time. So those are some of the things that we're going to be talking about. I just want to go, if I can get my slide to move, which is not doing again. Can we do next slide, please? For some reason, my slides are not moving. Okay, back one. Oh, no, back. Okay, so the Family Medical Leave Act at the federal level has been for employers with an excess of 50 employees, and qualifying employees who have been employed for at least 1 year can take up to 12 weeks of unpaid sick leave for those conditions that are listed on the slide. Serious health condition of family member, birth or adoption of a child, emergencies, and there are a variety of emergencies for family members on active military duty. The Family Medical Leave Act provides job protection and continuation of health care, meaning the employer portion of the health care. Health coverage must be paid by the employer, and the employee must pay the employee portion of the health coverage. In New Jersey, there's also a Family Leave Act, which provides payment basically similar to unemployment, where you apply through the state of New Jersey for a fairly minimal amount of payment to cover family leave emergencies, also related only to the birth or adoption of a child and caring for a family member. The New Jersey law does not cover a serious health condition of the individual themselves. So there's that aspect of it also, and there's a little bit of an interplay there. The new part of the FMLA, which is going to affect, can we do next slide, please? The new category of the FMLA, which is in the Family First Act, creates a new category which applies to employers who have less than 500 employees. Oops, I just saw the arrow was in the wrong way, but less than 500 employees, and you must post notices of this new category for your employees. So for employees who have worked for more than 30 days, they're allowed to apply for a 12-week FMLA only for the purpose of caring for a child who is less than 18 years old and whose school is closed and care needs to be provided. In this new category, the employee applies to the employer, who can grant it or not grant it based on reasonable decisions. The first 10 days are unpaid, but the employee can substitute accrued paid time off for unpaid days or paid sick leave under the next portion of the Act. The remaining days of leave would be paid for by the employer, but not at their regular salary. So there's a cap on the amount of money that will get paid to any employee under this new category for the Family Medical Leave Act, which is essentially 2/3 of their regular hourly rate times the number of hours worked. So if you have someone who is part-time or who works a truncated schedule, it will be based on their on the number of hours worked. There's a little bit more of a complicated formula for people who are hourly workers who aren't on a not full-time basis. So if you have questions about how exactly that's going to work, please contact us, but it was too complicated to put into this slide at this point. But generally, the cap amount for any employee is $200 a day, and it cannot be more than $10,000 in the aggregate. So if you're paying someone $200 a day for, which is essentially $1,000 for a 5-day week, and then they would be paid for 10 weeks essentially. So it would not be more than $10,000. Next slide, please. The Family First, the FMLA also provides for continued health coverage with the employer portion paid for by the employer. I have heard anecdotally that some carriers are waiving the employee portion of premiums during this healthcare crisis, but I don't have any more than anecdotal evidence. So I would suggest that if you have employees with questions about this, that you contact your healthcare carrier to see what their protocols are during this period of time. So for people in the medical field, which I imagine most or all of you are, that you have the right to exclude healthcare providers from receiving FMLA leave. So just so that everyone understands how this is going to work, the employee applies to the employer for FMLA leave, and but if they are a first responder, a physician, a nurse practitioner, PA, any of those things, those people, you can say no, we cannot give you family medical leave. Employers who have less than 50 employees, may apply for a waiver of the new FMLA requirement because it would be too burdensome on their business to be able to do that. But you have to, if people are planning layoffs, you cannot discriminate against employees who have requested FMLA leave and lay them off first, for example, or in a discriminatory fashion because they've asked for that. So that's something just to keep in mind. Again, when doing layoffs, which I know a number of my clients are contemplating at this point, you have to be careful not to discriminate in any way in terms of, protected class of gender, age, religious orientation, sexual identification, any of those kinds of things that would be protected in class. So if you're going to do a layoff, you have to be aware of that. And FMLA is also one of the areas where you're not allowed to discriminate. Next slide, please. So another part of the new Family First Act is paid sick time, paid time off for employees, which it does not require any particular length of employment. So if someone has to stay home to care for a child, and they have not been working for your practice for 30 days or more, they can still be entitled to the 2 weeks of paid sick time to be able to care for that child. So the 2 weeks of paid sick time does not mean you have to pay every single employee for 2 full weeks for full-time work. They are, and again, this only kicks in if an employee cannot telework. So in a medical practice, obviously, when you're doing patient-facing work, it makes it very difficult to telework, but unless you can do telemedicine. But for people who are doing billing and administrative functions, it may be that they would be able to telework. So if they can telework, you can allow them to do that and encourage them to do that to the extent that you have the capacity for them to be able to dial in to your system in a protected manner. But otherwise, they are entitled to the 2 weeks of paid sick time. So, and the 4 categories for paid sick time are listed on the slide, subject to state, local, federal quarantine or isolation. Or the doctor had asked them to self-quarantine because they were possibly exposed or experiencing symptoms themselves, or caring for a family member. It actually doesn't even need to be a family member. You're caring for another individual, not necessarily a partner or a family member, but it could be, I guess, a friend. The law doesn't specify that it has to be a close family member who is also experiencing symptoms, or the employee is caring for a child whose school is closed. So full-time employees will receive their salary for 80 hours of additional sick leave, which essentially is 2 weeks of sick leave. Part-time employees would receive the salary for a number of hours that they work in a 2-week period. So if somebody works 20 hours a week, you would only have to pay them for the 20 hours a week, not for 40 hours a week. And there are caps. Next slide, please. Thanks. There are caps on the amount of salary that you have to pay for an employee who is taking sick leave. So in the event that an employee is subject to local or state or federal quarantine or isolation, or the doctor indicated that they should self-quarantine because of their own illness or their possible exposure, the maximum for that, for their sick time pay is $511 a day with a $5,100 aggregate maximum. If for any other reason, so if they're taking paid sick time because they're experiencing symptoms or caring for someone else, or they're caring for a child who is out of school, the maximum is $200 a day. And it's actually, this is a typo on the slide. We were all up working on this late last night. It's actually a $2,000 aggregate. So the employer, this sick pay is in addition to any existing sick time that they may have. So New Jersey has a requirement for mandatory sick time. So this additional sick time is additional, or it may be that you have sick time that's allocated to employees in the practice. So you cannot require that they use their accrued PTO before using the sick time as provided in the Act. Now, again, how do we pay for all of this? So we go back to the tax credit. So the incurred salary and healthcare coverage expenses under the Family First Act, which would be the new category of FMLA, and the paid sick time under the Act will be essentially given back to the employers in a refundable tax credit, which is, it looks from the law like it's going to be based on a calendar quarter. But that's manifestly not clear at this point. There's going to be some regulations and some procedures that are going to be enacted, hopefully fairly quickly, to make a decision about how that's actually going to work. But ultimately, you should be, small businesses and practices should be getting their money back essentially for what you've laid out. That doesn't necessarily help your cash flow, but right this very second, because you have, you may not have the accounts receivable coming in, but yet you still have to lay the money out. So I know that there are a variety of small business loans, and some of you may have lines of credit that you can use in the meantime. But that's going to create an issue going forward, obviously. And but as we get more information on how that's going to work in terms of the tax credit, whether that's going to be refundable only at the end of the tax year or on a periodic basis, we will let you know as soon as we know. So I'm going to turn the rest over to back to Susan to talk about the challenges of testing and reporting under the new Act.
Sheila, thanks so much. I know you were up late last night and reviewing this and going through the entire law. And so we appreciate your efforts on behalf of all the healthcare community. So now I wanted to go over some of the challenges. There are many that you are experiencing and will continue to experience in the coming days and months ahead. Just want to reinforce to everybody that we are here for all the healthcare community as citizens of the United States. So we are here for you, and we are certainly here for the New Jersey physician community and our Conventus membership community as well. And I reiterate what Sheila said is we are so thankful that you're there out on the front lines helping us. You are doing as amazing and best job as you possibly can under difficult circumstances. So I'm going to go into testing and reporting. Again, I'm going to tell you to go to our website because this is really just a high-level overview of the testing and reporting and the challenges that you may have. And once again, I encourage you to put in the questions pane your questions so that we will have time at the end to answer your questions as best we can, because it's a fluid situation and keeps changing. So first is testing and reporting. We're going by both the CDC guidelines and also what the New Jersey Department of Health has put out and your local departments of health. If you have a patient who tests positive, you must immediately report it to your local health department. We have given you the New Jersey website to get the numbers for your local healthcare department. They are available 27/365. We have heard from many of our insured Conventus members that they've been having difficulty getting hold of a local health department. I am sure they are well overwhelmed as well. So If they are not available, here's some alternatives. You can contact the New Jersey Department of Health Communicable Disease Service, and the number is up on the screen between 8 and 5. It's 609-826-5964, or on weekends, evenings, and holidays, it is 609-392-2020. This is, I think, at this point, because we are a medical malpractice or a medical professional liability insurance carrier, from a medical professional liability standpoint, I see this as one of the major risks at this point, is that patients are calling you, you're not triaging, and you're turning them away, especially if they think they have symptoms. Doesn't mean that they can get testing, because you still need to follow the CDC guidelines. And as we all know, there's been problems with not only number of test kits, but also getting materials such as swabs and things like that. But please do not turn them away. You need to still assess them. The CDC has guidelines of what those questions should be, and I refer you to that. I've got the website with those CDC patient screening guidelines up here. So you really still need to triage all patients and keep in touch with them. The first thing I would suggest is, of course, as we all know, test for the flu. And if they're still having worse and worse symptoms, then you may have to think about something else. Or if you know that they have been in contact with someone who has tested positive or has been to any of the geographic locations, such as China, etc. So that's what I would suggest. Please don't turn anybody away. Patient messaging, I think a lot of people are in panic mode right now. And so they're going to be calling you, and maybe I'm sure some of you have already gotten bombarded. I would suggest you might want to start to head some of this off at the pass of having a recording on your telephone lines. If you have encrypted email or email in general, if you can do secure text messaging, put a message on your website and also on your patient portal. But I think right now transparency is key, and really getting the message out about what you are doing and how you're here to help them, and what happens if they think if they think they need to be tested. Again, you're going to explain that not everybody who wants to be tested can be tested. You are following the CDC guidelines. If you're in the office and you still have office hours, you're going to want to limit patient accompaniment by others. You may only want one other person to accompany that patient or not. You may have, if you're a pediatrician, you may stagger your well and sick visits, or in other offices as well. You may rearrange your waiting room chairs so that you're doing that 6 foot distance. If they're symptomatic, you might want to have them wait in their vehicle until you're ready, and then you can text them ready. And we've heard some are locking their doors and only allowing one patient at a time, not allowing walk-ins, those kinds of things. That's for your practice to decide, but we're just giving you some tips. Oops. Okay. As far as infection control and supplies, again, we've gotten questions about, what if the patient says they got it from my office? They've gotten the COVID-19 from my office. Well, as long as you're following infection control guidelines and you're cleaning and disinfecting after each patient, and you're doing what you reasonably could do with the supplies that you have, I wouldn't get too upset about that. We're going to tell you that you should try to disinfect with what's called EPA-approved emerging viral pathogens products. So you need to see whether that's on the label. And I can't stress enough that you need proper hand washing for both your personnel and your patients. It is extremely important. And maybe we have resources in our guide of putting up in your offices about washing hands, covering your cough. We have it all in one location, so you can just click on it and get to it. Personal protective equipment and supplies. What the CDC says is you've got to follow at least standard precautions because you're assuming that every patient is potentially infected. And I think that rings very true. I know that some of you have been having difficulty getting supplies. I suggest that you identify alternative suppliers, not just your regular suppliers. And also, I hate to say it, but Amazon does have some of those supplies that you're looking for because we've been checking on a daily basis. So you're going to do the best you can. The CDC also has interim infection prevention and control recommendations where it goes into in-depth what you need to be doing. Again, I can't stress that enough as well. They recommend cleaning first, so you get all the soiled material off first, and then with EPA-approved cleaner, and then you use the disinfectant with the EPA-approved emerging viral pathogens product. So that's a little bit about that. We have done a very high-level overview because we wanted you to, we wanted to get out at least the basic information to you. We've been discussing, we probably will have a follow-up webinar. Just let us know what topics you want to hear more about. And also this is, as we said, a very fluid situation. So we're going to update you as soon as we get the information. We're going to update you. And as you can see, we've got stuff that's hot off the press. So I'm going to turn it over now to answering your questions. Okay, I'm going to let.
Hi, thank you. That was a great presentation by both Susan and Sheila, and we thank them very much. So if you guys can give me 1 second, we're reviewing some of the questions on the chat, and we have one that is asking, can the encounter be done over the phone or does it require video? Absolutely.
So I'll answer that. This is Susan. Yes, it can be done over the phone if you assess that it has, that you can meet the same standard of care and you have asynchronous store and forward.
Okay. Another question is, in New Jersey, can new patients be seen for reasons other than COVID-19?
I'm assuming you mean, okay, so there's a couple scenarios. So the first is I'm thinking you're probably thinking about telemedicine. So telemedicine, if you're licensed outside of New Jersey and you have never seen the patient before, you didn't have an established relationship, you can only see them for something related to COVID-19. If you're a New Jersey licensed provider and you can see a patient via a telemedicine encounter, either as a new patient or an established patient for anything, not just for COVID-19. Now you're going to have to check with the carriers to make sure what is covered and what's not and what you can bill for.
Okay. We have a question regarding, does the patient have to initiate the telemedicine call or telemedicine service? How can that be done? Can the provider place the call or inform them of they have to contact us? How would we try to do that since the patient has to initiate it?
So you can beforehand talk to the patient and walk the patient through it and give them instructions, but they have to initiate the call.
Sheila, I'm going to.
And by the way, some of the telemedicine apps that we gave you, that's fairly easy for them to do that. It's like they were waiting in your waiting room. So I just want to say that you take a look at those apps, and one's for free and one is for $49 per month per user.
Sheila, I have one for you.
Yeah.
A question.
Oh, okay.
How do we apply for a waiver? They have small employees. I've got quite a few people asking, can companies with less than 50 employees apply for the waiver? How do they do that? And what is with that tax credit?
Okay, so so yes, you can apply for a waiver. The law was signed yesterday, so there is not a and it doesn't go into effect until April 2nd. So they actually haven't put a mechanism in place for letting people know how they would apply for the waiver. So I think at this point, the answer is I don't know, but I will look into it, and as soon as I have some certainty on that, I'll let whoever we'll send out a mailing to people to let them know that how that's supposed to work if you do want to be able to waive out of FMLA.
Okay.
Because remember, with the ordinary Federal Medical Leave Act only applies to practices or to employers that have more than 50 employees. So it's only this new category of FMLA where people it can take up to 12 weeks of leave if their child is out of school that applies to employers with less than 500 employees. So ordinarily, under ordinary circumstances, FMLA does not apply to any employer with less than 50 employees. So it's only this particular aspect of it that would apply. But there is a waiver provision, and we will follow that up and find out for you exactly how the waiver is supposed to occur as soon as it's put out.
Thank you, Sheila, very much for that.
Sure.
Yep. Okay, I'm grabbing a couple more questions. So we have some questions regarding how would you order testing if you had to order X-ray, MRI, or any even lab tests. How would you do that, which requires a prescription?
Okay, I'll take that. And so if you have an electronic health record, that may be a little easier. And if you're hooked up to the labs, obviously that's a little easier for you to do. Or if you have a patient portal, you can do that. You can provide that to the patient through your patient portal. If you don't have those kind of electronic technologies, you're going to have to write a physical prescription for them and get that to the patient.
We just have a couple more questions, and I think we're going to just try to clarify about seeing new patients and billing for telemedicine. And again, we're going to go back to, I'll let Susan go back to sort of the state law with that, because it does vary based on your state law requirements, correct,
Yes.
Susan?
So that's why I keep on saying in New Jersey, you can see new patients who you have never seen before, as long as you feel you can meet the same standard of care. And if during that telemedicine encounter, you start to feel that you can't do this, you must stop and you must tell them that they need to go to an urgent care center or come in, or however you're going to handle that. For the other states, you need to know your state law, because it really varies by state law of what you can and cannot do. In some states, you cannot do telemedicine for new patients. New Jersey, they wrote it into the law that you can do it for established patients. So you're going to have to know your state law.
And this is Carolyn. I'm going to jump in and just for when we read the regs, we have to read them at when it does say you have to be able to, and I guess we're reading it this way, look at getting that new patient paperwork, as Susan was saying, the same way that you would do that before you a patient walked in your office. So you're changing the mode and the way you do it, but you're getting that patient paperwork as best as you can up front through other technology means so that you can review it, you can review their history, you can ask questions, and then you would schedule that visit, office visit, electronically. Basically, it's going to be that telemedicine side. So that's how you can move through that. You're not seeing them blindly. The law does say you have to get some of that paperwork up front.
And this is Susan again. Thank you, Carolyn. I just also want to reiterate for our New Jersey Conventus insured members, I strongly suggest that you contact us, and I have the contact information on the last slide for both Sheila and myself if you have questions, but we can help walk you through it so that you're meeting the laws and regulations the best that you can, because, you need to do whatever you can to meet the laws and regulations to protect both yourself and your patients.
Okay. Sheila, a couple more questions for you. I know we have a good bit more. We have some more time. Somebody was asking, does the new Family First law apply to employees that were laid off prior to the 4/2 effective date?
That's a very good question. Again, that it's because it was enacted yesterday, and I've actually had people ask me that. I have to anticipate that they're going to take into account what, when this goes into effect, that it's going to apply, that there's going to be some mechanism to be able to apply it retroactively. But that being said, there is nothing in the law that says that. So I would think, because I know that a lot of my clients are contemplating starting layoffs, before April 2nd, that it would make sense that people would be able to go back and apply for FMLA or apply for paid sick leave during that, even if they've been laid off beforehand. But that's not in the law yet. I imagine that things are going to shake out a little bit when people, realize that there were some deficiencies in the way this was set up. So hopefully that's going to be rectified. At this point, there's no guidance on what happens if someone's been laid off prior to April 2nd.
Okay. And another question, Sheila.
Except let me just add one more thing though quickly, just so that I didn't get a chance to put this into the slides, but New Jersey has part of the Family First Act is to enhance unemployment access for people, and I know that when that there's going to be a very allegedly speedy process for dealing with applications for unemployment, and that the waiting week, the usual week that you go without unemployment, is going to be waived in this situation, as are the requirements that you actually go out and look for work. So essentially, they're not going to follow that up and not going to require that people document their work search during this period of time when they're receiving unemployment.
Great. And following up with that, Sheila, I'm going to keep you on for a second to answer one more.
Sure.
And I'm going to read this out kind of the way it is. What is the responsibility of a practice to part-time employees in regards to layoffs, providing work compensation, et cetera? I think it's maybe, asking, what do they have to do?
Well, the paid sick time and FMLA does apply to the new category. Does apply to people that are part-time. So if they are, they don't have to be full-time employees to qualify for this. So there's a way to calculate the maximum amount of compensation that you would be required to pay with the paid sick leave or paid FMLA over a period of time based on their average number of hours. In practices where people kind of diverge, where there's not really a necessarily average number of hours. If you have someone who comes in and covers, a certain period of time, and their hours may vary significantly from week to week, there's a way to calculate it and to average. It's in the law. But if somebody's interested in that, I can provide more guidance. But it's a lot for for this particular event. We were just trying to hit the high points, kind of. But so yes, it does apply also. Long answer to short question. It does apply to part-time employees also, and so that's essentially the obligation of the employer based on whether you are laying people off or or paying them out for FMLA or sick time.
Thank you. Lots of questions on resources and supplies and where can you get them, because things are on back order. We understand and know that Amazon is they are trying to just prioritize shipping of medical supplies, but Susan, people are asking where and
Yes.
What can they do?
So we have compiled a list of alternative suppliers that we will put up on the website. And there's a number of them. We can't guarantee anything. You'll have to call each of these suppliers, but we have tried very hard to compile this list. I think this is an evolving situation, and I think it's going to change day by day, because I know that some of the construction companies have been asked to give up their N95 masks and things like that. So don't know what's going to happen with the federal government and how they're going to be stepping up production. So it's an evolving situation. I don't know if there's I don't know if there's any easy answer to that, other than we've tried really hard to get a list of alternative suppliers for you. So we will make sure that that's up.
Okay. A couple people have asked for some of the names of the websites again for the telemedicine apps that are available.
Yeah. So you have it in your handouts. There's a handout section of this that we've given you the handouts. One is DoxyMe, DOXY.me, and the other is V as in Victor, S as in Sam, E as in exclaim, E as in exclaim. So it's DoxyMe and VSEE. And there's others out there, but those are just the two that we've tried to vet so far. Carolyn and I have been listening. We called the vendors up. We've been listening to their webinars on how their products work. So we can't guarantee anything, but those seem to be pretty reasonable.
Right.
DoxyMe is for free.
Right. And there's another one, Medi, MEDI, Sprout. Another one that's somewhat free and is still up and running. Just be cautious too that a lot of these telemedicine companies are struggling too. Their networks are struggling under the load of people jumping on all at once. If you have an electronic health record, please try to leverage what you can in that, because that would be your other best way of documentation. And we have not gotten to all the questions. We're still going through them.
We have a couple minutes left.
Yeah.
For those questions that it's actually 1:13, so we promised that it'd be over at 1:15. So if we have a short question, we can answer that. If not, all the questions that we have not been able to answer, I think that's how we're going to do it. All the questions that we have not been able to answer, we are going to send out something to all the attendees with the answers. Yep. We should have your email addresses, so we're going to do that. I would also encourage you to please fill out the survey so that it's 3 questions. That's it. We want to know if you want to hear more in depth, and also if you want to hear COVID-19 information hot off the press as it comes out. So we really need to know that, because Sheila and I are available to do a series if there seems to be interest in doing that.
Okay.
Is there one more?
I'm going to give one more to you, Sheila. a question came in just the second. Will the FMLA forms be updated and distributed by the state to include the added parameters to the law? And should these forms be documented and collected?
Yes. Let's say that yes, there should be as I understand it, there's going to be signage and handouts and forms that are being prepared. But as far as I know, at least as of this morning, they have not come out yet.
Okay. Terrific. Thank you. Thank you so very much for all of that. As Susan said, we are going to compile a list of these questions. We will send them out. Here's a little info on Conventus. We are a professional liability insurer formed and governed through an alliance of physicians in New Jersey. We are dedicated to our physician membership, as we call them. We offer some various services, and you can read them all there, and you can see. Capehart Scatcher is a regional law firm with offices in New York, New Jersey, and Pennsylvania. The healthcare group represents a tremendous amount of clients. And here is the contact information for both Sheila and Susan. You've got our websites both on there and emails to contact and phone numbers. And thank you. We're going to, as soon as this webinar is finished in the next second, we will be compiling this. It will be posted on our website. You will be able to find it under the practice resources link. We'll have a COVID-19 link. It is not there yet. It will be there in a few minutes. For those, the handouts were attached in the handout section of the webinar. If you did not get it, please don't hesitate to email one of us. And again, thank you all for being here. And we look forward, excuse me as my voice cracks, to having our next webinar with you. Have a great day.
Stay safe.
Wash your hands.
Thank you.
Yes, thanks. Bye-bye.